So the instrument that I'm going to be using on you today is called an integrator. The technique that we use is called torque release technique, and it's been proven by research to be the most effective and reproducible technique in the history of chiropractic. So this allows us to hone into the individual bones, making them a very gentle and precise adjustment, which allows your body to heal and function at a higher level. It also accompanies torque. So whenever we pull back, you can see how this is moving nice and straight. We can also turn it from side to side. The integrator will twist, and it makes the adjustment that much more precise. So it's going to sound a little bit like this, so don't be alarmed by the noise. It's just making the adjustment as it makes that noise. Any questions? All right, Mama, have you lay down? Okay.
My hands like this?
Yeah, that's perfect.
My hands like this?
Yes,
Right.
just like that.
I need a hole in the paper though.
Oh.
Right down.
So as part of the analysis of the pregnant mom, we're going to be palpating down her spine, starting from the occiput and moving down to the sacrum. We're going to be feeling for areas of tension, edema, tenderness, feeling if we're finding any posterior vertebra, feeling along the sacrum, along the iliac crests, and just making a note of the overall tone of the spine. Another check that we do in pregnant women, whether the the baby is breech or not, is the Webster Technique check. So we're going to be checking the legs for sacral tension. We're going to be doing heel to buttock. And as you can see, she has here bilateral tension. So her baby is actually positioned transverse. So that would be the correct indicator for a transverse baby. She's going to have a BP sacrum in this case. Now, if she were to have a breech baby or something along those lines, we could see one of the legs having less tension than the other. So this leg may not go back as far, or this leg may not go back as far. Now, it's important whenever you're doing these checks that you're meeting them at their resistance. You're not pushing through the resistance, you're just kind of letting the feet go to where they'll naturally fall and not pushing further than that. So whenever we're making the adjustment for a Webster mom, in her case, we would be doing a BP sacrum because that's what her indication is, and that's also how her baby is presenting. So we are going to find the base of the sacrum and make the adjustment with the integrator.
You want my shirt up or pull it down?
Yeah, that's good like that. So when a mom comes in and she is specifically coming in for a malpositioned breech baby, a transverse baby, in this case the baby is transverse, so we're going to palpate the belly. We don't have an OB license, so it's not within our scope to tell the mother what position the baby's in. She always needs to verify that with her OB. However, most of us are able to tell where the baby's positioned, so that kind of gives you just an idea of how the body's changing and moving, but she always needs to get this checked with her OB. And another thing that's important to keep in mind is that we are not turning the baby. We are not doing anything to physically turn the baby. All we are doing is making adjustments to the pelvis and working on the tension in the round ligament, which decreases tension in the pelvis and allows the baby to move into the head down position, which is the proper position. So in no way are we physically turning the baby. So I'm just going to palpate the belly a little bit, just get to know mom and the baby a little better. And so we're just going to find the round ligament. In a normal, in a non-pregnant woman, the round ligaments are not palpable. But as the pregnancy progresses, the round ligaments, the mom can not only feel them stretching, but sometimes she can feel twinges in them. Are you having any round ligament pain?
Not much this time. Yeah.
So the amount of pressure that we're going to be using is just meeting the resistance where it's at. We're not going to be pushing hard into the round ligament. It's just very gentle. You can just slowly rotate the fingers like 5 degrees at a time, the thumbs. And we're going to be giving the round ligament what's called sealing. So we're going to be contacting the round ligament, and then we're going to be stroking up towards the ceiling. So we're lifting the ligament, and then we're going to gently rotate it 5 degrees at a time. Is that pressure okay?
Mm-hmm.
Now, in her case, we're going to be doing both round ligaments because her baby is transverse. She had tension on both sides for leg. Now, if the baby were breech, we would be doing opposite round ligament. And we follow Webster protocol whenever we are doing Webster technique. So in this case, we would not be adjusting anything else the same day. We would see her 3 days in a week, and whenever while the baby is presenting in the transverse or breech position, we're not going to be adjusting anything else. As soon as the baby turns head down, we're going to continue checking her Webster technique, but then we'll also address other areas